3 simple changes you can do now to help your pelvic floor dysfunction is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy, right here in Irvine, Orange County. When I came across this topic, I thought, my gosh, having 3, there's so many. So I had to really think through and see what are the 3 ones that I see commonly being violated. So the first one is make yourself feel very comfortable sitting on the floor. You don't need to suffer through it, but when you have a chance and you need to sit down, instead of sitting on the couch, sit on the floor. Make yourself comfortable. That does not mean you put a pillow behind you and you sit like that. Sit on your seat bone and with your back against the couch, and sit with your feet, your knees, and your hips about the same distance from each other. And just hold yourself there as you're watching. So this is a good exercise, and I'm going to show you the side view. I'm a little bit forward compared to the back, but if you're sitting on the couch or against the couch, bring yourself back and sit like this. If you're able to do this, it's better to sit with both feet flat. If you're not comfortable, you can alternate. You can start doing this for, 2-3 minutes at a time, and just work your way up. Just become very familiar with sitting on the floor. It's good for many, many reasons. Another one that I really want you to consider is the ability to squat down. When you're squatting down, you're working on your inner abdominal pressure, you're working on your inner and outer thigh. It's just overall really good for relaxation of the pelvic floor itself, the floor of the pelvis. So what we want to do is we want to be able to squat down with our feet flat on the ground, just like so. If you're not able to do that, you can use a yoga block and you just sit there like so. It's close enough that you can work up until you no longer need to sit on the yoga block. Finally, I want to bring your attention to the importance of your work environment. If you're sitting on a chair and you're typing away and you're looking at your devices, it's best to sit on an exercise ball. Sitting on an exercise ball is not necessarily just working on your core. The reason it works on your core is because it stimulates the portion of your brain called PMRF, which is in charge of the command upright against gravity. So if we stimulate it, then that command comes from the brain instead of some zapper tell you upright. And over time, you do build proper core because you're breathing better. So I think that by sitting on an exercise ball, you're doing multiple things. Overall, it's a great thing. So typing or not, looking at your devices or not, if you have an option at home or work to sit on an exercise ball versus a chair, I much rather see you sit on the exercise ball. I hope these little tidbits are helping you manage your posture, your movement better, so your pelvis, your pelvic floor, and your skeletal system in general can be more in sync with your expectations. Until next time, take care.